Chapter 9: Senior Housing and Living with Compassion and Awareness. To care for those who once cared for us is one of the highest honors. Tia Walker. Not that long ago, there were basically two options for senior living: living independently in one's own home or apartment, or full-time skilled nursing care. The assisted living concept was created to provide an additional option bridging the two. To help you find senior housing that suits your needs or the needs of your loved ones, here are some options for your consideration. Assisted living is a community-based, long-term living arrangement designed for seniors who need some help with the activities of daily life, but who want to preserve as much independence as possible. Typically, the help seniors get in assisted living facilities is individualized to meet each resident's needs and desires. Depending on the situation, services can be added or removed as circumstances and choices dictate. No single description can paint a complete picture of what assisted living is. One community may look like a modern high-rise apartment building. Another might look like a quiet suburban townhome community. Still another may resemble a resort hotel or a country club. But we can make some generalizations. Seniors who live in assisted living communities typically will have their own private apartment-style living quarters with convenient shared services on site and nearby. Services usually include meals, social and recreational activities, and varying levels of therapeutic and medical assistance. Another generalization: residents of assisted living communities are overwhelmingly satisfied with those communities and the lifestyles they afford. There is no single national standard that defines what assisted living communities must provide. Providers are licensed at the state level, so the requirements of what it takes to offer assisted living services vary from state to state. Just as you would with any product or service you buy, ask any provider you are considering what is included with the basic monthly fees and what services are available at extra cost. It's also a good idea to check with your state's licensing authority to learn what are your state's standards. You might hear the term continuum of care associated with the assisted living concept. Some senior-focused communities say that they offer the complete continuum of care, from independent living to 24-hour skilled nursing care. If independent living is at one end of the continuum and full-time skilled nursing care at the other, you might deduce correctly that assisted living is in between the two. It is a happy medium, if you will. If you ask seniors in the United States what is most important to them, maintaining as much independence as possible is a nearly universal answer. As we age, we might remain largely healthy and vigorous, yet still find one or more of the activities of daily living increasingly difficult to manage on our own. Sometimes a spouse, family member, or friend can help us, but if not, should skilled nursing care be the only alternative? In hindsight, it seems obvious it should not. Yet before assisted living was developed, those were basically the options. You will hear the term continuum of care used most often in the context of senior living communities that include separate but adjacent sections offering independent living, assisted living, and 24-hour skilled nursing care. These appeal to seniors and their loved ones who know that the senior adult can remain within one community setting and maintain the optimal balance of independence and assistance as time goes on. The cost of assisted living is typically billed monthly. Many communities offer tiered pricing so that residents who need or want fewer services can pay less, with costs increasing as more services are included. Those who are now living independently, but exploring assisted living as a potential option for the future, often find that the cost seems high, but they usually are not making any apples-to-apples comparison. Far from being just an apartment, assisted living includes many living expenses you might take for granted. Daily meals are usually one of those expenses. Many people vastly underestimate their monthly costs for food. Not only are residents of assisted living communities sparing the expense of buying food for their meals, but they are also spared the time and effort of shopping for and cooking all of their meals. Utilities such as electricity, water, and gas service are also typically included, as are maintenance of the grounds and the living quarters themselves. Then, too, there are some benefits of assisted living whose costs are difficult to quantify, such as greater measures of safety, security, and community. While it's true that costs among different communities themselves can vary widely, when comparing the cost of independent living, be sure to take all that is included into account. We can, however, make some generalizations about costs. According to Genworth's 2016 Cost of Care survey, the median average cost for assisted living in the U.S. is $3,628 per month, or $43,539 annually. Actual quotes may differ from what is presented based on timing and services required. The level of services provided and other factors can cause the costs of communities in the same area to vary widely. Costs will also vary by region. Where the general cost of living is higher, the cost of assisted living will most likely be higher as well. Most people pay for assisted living through their financial resources. This might mean using some combination of a pension or annuity, plus savings and investments. Sometimes financial help from one's children or other family members comes into play. Seniors who own the home they live in might see that asset as an ideal way to finance the cost. They may, for instance, choose to sell their home outright and use the proceeds to pay for assisted living, or they may rent the home. A third option is a reverse mortgage, which allows one to borrow against the equity of the home while retaining ownership of it. If you decide to use your home or another real estate you own to finance your care costs, be sure you understand all of the details and ramifications of such an agreement. For many, long-term care insurance offers a good way to finance a comfortable lifestyle at the facility of their choice. Do your homework, though, because several factors can affect your long-term care insurance costs and benefits. Some government programs, such as Veterans or Medicaid benefits, may help pay for care, though that help may be somewhat limited. Medicaid policies vary greatly from state to state. Few people factor senior living care into their long-term financial planning. While there are understandable reasons for this, the more you plan, the more options you will have should the need arise. Still, chances are there are assisted living communities near you that will meet the needs and budget of you or your loved ones. The services offered by assisted living providers will vary depending on the community. Some communities offer services in a range of tiers and fees, so the services you receive can be customized to your needs. In general, basic services provided will include comfortable private living quarters, 24-hour security and supervision, emergency call systems in each apartment, daily meals and snacks, housekeeping and laundry service, medication services, wellness and fitness programs, social and recreational activities, and shopping and transportation assistance. In a nursing home report written by Claire Simmons, over 1.4 million people in the United States currently receive long-term care in a nursing home. This number is expected to double by the year 2050. Unfortunately, with over 15,700 nursing homes in the country, the quality of care provided in each nursing home can vary substantially. This is a major concern for families and residents. How do they know the facility is reputable and safe and has a caring staff? Seniors are one of the country's most vulnerable populations. Often, ensuring the safety and security of the nursing home facility is a duty that falls to the senior's family, usually their adult children. Nursing home facilities are subject to strict regulation and oversight. They are often regulated on the state, by the state health departments and city levels, or by local regulations and ordinances. Nursing home facilities are also regulated on the federal level. This is because nursing home facilities are funded by federal Medicaid funds. To understand how nursing homes are regulated, the basic functions of the facility must first be established. Nursing homes throughout the United States provide 24-hour skilled medical care for seniors. Typically, the senior will require at least some degree of assistance, with one or more activities required for daily living. Activities which require assistance include dressing, preparing meals, bathing, or other hygiene-related issues. Management of prescription medication and other medical care is another major service provided by nursing home facilities. Over half of all nursing home residents are over the age of 85. This age group is expected to increase until the year 2026. Additionally, the Centers for Disease Control and Prevention expect that more than 2.8 million people will need nursing home care by 2050. As the nursing home population grows, proper oversight will be necessary to ensure both existing and new facilities are safe, accountable, and secure. On March 25, 2016, the Nursing Home Data Compendium of 2015 was published. This document, created by the Department of Health and Human Services, pulled data from three major sources: the Community Assessment for Public Health Emergency Response, CASPR, database for survey and certification information, the U.S. Census Bureau for population data, and the Minimum Data Set, MDS. CASPR is designed to provide public health leaders and emergency managers information about a community so they can make informed decisions. The U.S. Census Bureau is the leading source of statistical information about the nation's people. Our population statistics come from decennial censuses, which count the entire U.S. population every 10 years, along with several other surveys. The minimum data set is part of a federally mandated process for clinical assessment of all residents in Medicare or Medicaid-certified nursing homes. This process entails a comprehensive, standardized assessment of each resident's functional capabilities and health needs. Assessments are conducted by trained nursing home clinicians on all patients at admission and discharge, in addition to other time intervals, e.g., quarterly, annually, and when residents experience a significant change in status. Overall, the results are generally positive and reassuring. The number of deficiency-free facilities increased from 8.8% in 2009 to 10.2% in 2015. Note, this is an increase in facilities that were found to be free from issues. This is a reversal of a previous downward trend. From 2005 to 2008, reports of health deficiencies in nursing homes were on the increase. Regulation and other factors have helped decrease health deficiencies. There are 5 major categories of health deficiencies. 1. Improper storage and/or cooking of food. 2. Accidents caused to residents due, at least in part, to lack of employee supervision. 3. Accidents caused to residents due, at least in part, to improperly maintained facilities. 4. Improper resident care involving physical and mental well-being. 5. Lack of proper measures to control and prevent the spread of infections. Some of these are also considered deficiencies in the quality of care. The good news is findings of substandard care have also decreased. In 2008, substandard care reports were at 4.4%. This dropped to 3.2% in 2014. The report also identified states with an increase in nursing homes as well as ones with a decrease. 19 states had an increase in the number of facilities. Of those, the biggest increases were in Alaska, 20% increase, Nevada, 8.2% increase, and Arizona, 5.8% increase. States with the biggest decline in facilities were Vermont, 7.5% decline, North Dakota, 5.9% decline, and Maine, 4.6% decline. Selecting a quality nursing home is often a job for the adult child of the senior who is looking for nursing home care. Unfortunately, there is no real shortcut here. Finding a high-quality nursing home requires time and legwork. Experts recommend a visit to the nursing home. While a scheduled visit is usually a great step initially, searchers are encouraged to stop by the facility during the day unannounced. This will help determine both a more accurate picture of day-to-day activities as well as general security of the facility. There are two major areas that can reveal a lot about the state of the entire nursing home: the facility and the staff. An older facility is not necessarily inferior, while a newer facility isn't necessarily superior. The important issue is the current state of the facility. First, is the facility clean? Next, is it well maintained? Even a high-quality nursing home will have ongoing maintenance issues. The issue is how quickly and efficiently maintenance issues are handled. Additionally, nursing home maintenance requires special challenges. Nursing homes require a calm, quiet atmosphere. Is any construction kept away from the residents as much as possible? Are the maintenance employees friendly and eager to interact with the residents? Does the staff treat the residents with friendliness and respect? Obviously, even the worst staff will be on their best behavior during the initial meeting. Therefore, experts recommend unscheduled visits. Also, established residents are often another useful source of information. Aside from the courteous professionalism, staff availability is another major factor in overall resident safety. The staff-to-resident ratio should be high enough to ensure residents are never left unattended or in potentially dangerous situations. The nursing home data compendium brought a lot of relief to anyone looking for nursing home care. Substandard quality of care and health deficiency are at an 11-year low. As the population ages and nursing home care is required by more and more people, the recent report adds a bit of reassurance to anyone hesitant about finding a quality facility. Independent living, often referred to as retirement living, is the term applied to a senior lifestyle that maintains an active nature and level of independence. Where many seniors could use the valuable extra assistance that comes with home care or assisted living, others don't require that level of care and seek a more active lifestyle and community. Independent living and retirement communities help seniors achieve this by providing an environment where retired adults can live among their peers, while taking advantage of the many amenities and activities these communities provide. Picking the right retirement community for you is a big choice. Search the independent living communities close to where you want to live, and read reviews to see what other seniors and their families have to say about their experiences. According to senioradvisor.com, the average consumer rating for independent living communities on senioradvisor.com is 4 stars out of 5. Independent living communities in Nebraska, Rhode Island, and Kansas tend to be rated higher than the national average, whereas communities in Mississippi, New Jersey, and Delaware tend to be rated lower. The states with the most independent living communities are California, Texas, and Florida. How much does independent living cost? As for amenities, living quarters, and property values vary for different independent living communities. There's a wide range in community costs. In general, some retirement villages or communities average $3,500 a month. Actual quotes may differ from what is presented based on timing and services required. Often, that includes features like regular meals, healthcare on staff, and access to fitness facilities and other amenities on site. When it comes to independent living options, communities offer an array of features and amenities. Not every item listed below is available at every retirement community, but this list gives you some idea of what to expect and look for. Some of the common services you can expect to find are a variety of activities offered on site, ranging from movie nights, knitting groups, educational classes, trips to nearby sites, meals offered by the independent community's on-site chef, fitness options, such as workout equipment, pools or hiking trails, senior apartments, many with features like kitchens or balconies, senior homes, senior houses, transportation services, medical staff on site or that come for visits, and even beauty and hair services. Memory care is specialized care provided to those with varying degrees of dementia or Alzheimer's disease. It involves creating a safe, structured, home-like environment that enables residents to enjoy as fulfilling a life as possible. Alzheimer's disease is typically referred to in 3 stages: early, middle, and late stage. Many people are familiar with the early or mild and the late or severe stages, but not sure what to expect from the middle stage. Moderate or middle stage Alzheimer's is generally the longest stage of the disease, with some living in the stage for several years. As the disease progresses, family members and caregivers may notice behaviors such as needing assistance performing daily tasks, such as bathing or dressing, difficulty following a conversation or remembering details about what day it is or their family history, withdrawal from social situations, behavior or more frequent mood changes, including becoming agitated, suspicion of others, changes in sleep patterns, such as wanting to sleep more during the day, and difficulty sleeping at night. Medicine's understanding of Alzheimer's and its effects on the human brain is still in the pioneering phases. While we learn more all the time about how genetics, life events, and lifestyle components are involved in catalyzing the initial signs and progression of Alzheimer's, the cure remains elusive. The more you remain up to date on the current research and studies findings, including Alzheimer's facts, figures, and statistics, the better you can improve the quality of life for yourself and the ones you love. The following facts are derived from 2 helpful Alzheimer's disease resources: the NIH's page on Alzheimer's disease facts and alzinfo.org. AD is the 6th leading cause of death in the United States. Most people with late-onset AD exhibit signs and symptoms as early as their 60s, even if the diagnosis doesn't happen until much later. Experts believe that AD-related changes in the brain may start as much as 10 years before the beginning symptoms are detectable. Early onset AD comprises about 10% of the Alzheimer's population and is typically noticed/diagnosed between the ages of 30 and 60. Someone is diagnosed with AD about every 65 seconds. Doctors predict as many as 14 million Americans will be living with Alzheimer's by the year 2050. 1/3 of all seniors die with Alzheimer's or some other dementia-related condition. It costs about $350,000 per person to support the long-term health and well-being of an AD patient. There are multiple forms of AD and dementia: early onset, late onset, Parkinson's-related, etc. Care and treatment plans may vary depending on the type. Alzheimer's genes are identified, but they are not the sole cause of AD. Nor does the presence of the genes mean an individual will get AD. There is no specific treatment for AD or dementia, although some slow its progression. Certain lifestyle changes have been shown to slow down the progression of AD. These last 2 points are part of what makes living with Alzheimer's so challenging. Currently, there are not always clear reasons why a person has the disease. and there is no tried and true treatment for AD. Recent studies have shown that high-fat, high-sugar diets prime the brain for AD. Diets that are higher in fats, sugars, and processed foods contribute to inflammation in both the hippocampus and the frontal lobe of the brain, two areas that experience AD decline. In closing this chapter, if you or your loved ones need the services of any of these long-term living arrangements, especially memory care, I recommend that you make the necessary legal arrangements if something happens to you. Ensuring the property, if any, is transferred to the right party when the time comes is a key aspect of estate planning. A life estate and an irrevocable trust are the two different methods to go about this, each with its own advantages and disadvantages. I highly recommend the creation of a living will or trust on file with an attorney or a trusted family member. A living will informs your doctors about your preferences for medical care at the end of life. There are 5 main points of trusts: living trust, testamentary trust, revocable trust, an irrevocable trust, a funded or unfunded trust. Each different kind has its own uses and purposes, and because these are legal documents, you should use an estate planning attorney to help you understand, write, and execute them.